Andrej Szczeklik died on February 3 this year, and I'm very honored and grateful to speak in memory of our beloved colleague Andrej Szczeklik. I met him for the first time at our academy in 1994, and I always remember his self-presentation, modest and to the point. He gave then a moving testimony of his admiration and love to Pope John Paul II. Some years later, he gave me as a gift his inspiring book, Catharsis, on the art of medicine, with a foreword by the great Polish humanist and poet Czesław Miłosz. A continuation of this book is called Chore, on sickness, the sick, and the search for the soul of medicine, a suggestive title that reveals the spirit and the mission of a man totally dedicated to his patients and science. Andrej Szczeklik was born in Krakow in 1938, where he studied medicine. He did postdoctoral training and research at the Karolinska Institute, Uppsala University, and North Carolina, Chapel Hill. He became professor and chairman of the Jagiellonian University School of Medicine, Krakow, and president of the Copernicus Academy of Medicine. He was a member of the Polish Academy of Arts and Sciences, the Royal College of Physicians, the American College of Physicians, and the Pontifical Academy of Sciences. He became an active participant in all our plenary sessions. He received honorary doctorates from the Schools of Medicine of Wrocław, Warsaw, Katowice, and Lodz. He was awarded the medal Gloria Medicinae by the Polish Society of Medicine. He received the first prize of the Lancet for the paper reporting on genetic polymorphism of leukotriene synthase. In 2001, he was awarded the gold medal and the Robert Cook Memorial Lectureship by the American Academy of Allergy, Asthma, and Immunology. His whole life was dedicated to the study and treatment of cardiopulmonary diseases. He was one of the first to discover the mechanisms of non-steroidal anti-inflammatory drugs that precipitate attacks of asthma in sensitive patients by inhibiting cyclooxygenase COX-1, a key enzyme in the metabolism of eicosanoids, substances produced by arachidonic acid. He was a leader of the European network of aspirin-induced asthma, centered in Krakow. He discovered the genetic polymorphism and overexpression of leukotriene synthase in patients with aspirin-induced asthma and the alteration of the metabolism of arachidonic acid common to asthma and urticaria. He studied the history of salicylates, the forebears of aspirin, the drug that was produced by the pharmaceutical firm Bayer in 1999 and became the most popular drug in the world. His paper, The History of Aspirin, the discoveries that changed contemporary medicine, presented at our plenary session 2004 and published in Paths of Discovery, was a remarkable contribution to our understanding of clinical investigations. He also worked in the mechanisms related to blood clotting after the discovery by his colleague Richard Griglewski in 1976 of prostacyclin in humans, a local substance produced by the lining of blood vessels that produces vasodilatation and inhibits blood clotting. In his book, Catharsis, he vividly described the first test of the drug in themselves at the Hospital of Krakow using a sample of the molecule synthesized by Joseph Fried, and how he was affected himself with high fever after the infusion, intravenous infusion. The prostacyclin, in that case, was contaminated by bacteria, and how Griglewski lost consciousness because of the massive vasodilatation and the lowering of blood pressure. After other self-experiences without any complications, they started to treat patients with serious diseases of peripheral vessels. I quote, "How many days and nights we spent at their bedsides, listening out for the piercing pain in the feet to quieten down and not believing our own eyes when the deep ulcers on their skin shrunk and dwindled as the blood was mixed with a daily dose of prostacyclin." End of quote. Today's tablets analogs of prostacyclin are used in the treatment of pulmonary hypertension and also in the treatment of atherosclerosis. It was also discovered that aspirin inhibits blood clotting and that statins that reduce blood cholesterol also inhibit blood clotting. Szczeklik, the remarkable internist and scientist, the mentor of a generation of Polish physicians, who has published more than 600 papers, was also a humanist, a writer and a musician, a lover of the arts, a man of deep faith that practiced medicine as a sublime humanitarian art. He said, "An internist is like a symphony orchestra conductor. Specialists are like individual instrumentalists. They do the playing, but only the conductor knows all the instruments and what to expect from them." In his book, Catharsis, he wrote that medicine concerns perhaps the strongest of human desires, a longing for love, which is usually unfulfilled. We will miss him.